So hi everybody, welcome to Live with Children here at Advanced Therapies Congress at the Excel in London. I'm delighted to have my Ray Marley from Accellix, who's going to give me a quick overview of the business and what we're talking to delegates about this week. So first of all, Ray, it's lovely to see you. How are you?
I'm doing wonderful. We are excited to be here at Advanced Therapies 2022. Meet all the amazing people that are advancing cell therapy markets.
Brilliant. Now, for those people not familiar with Accellix, could you give me a quick overview of the business and what we do?
Absolutely. So we have developed, we manufacture, and we sell a cartridge-based benchtop flow cytometry platform with algorithm-based automated analysis. And what that means to say is that we have automated the QC checkpoints that are used in flow cytometry, and we've streamlined it to basically go from sample all the way to analysis in just 30 minutes.
Fantastic. So how does that differ though from what's already out there in the market?
So if you compare traditional flow, so traditional flow cytometry is amazing, right? But it's also considered an art form. The reason that it's considered an art form is because you have many manual steps. You have sample preparation, which is very manual. It's done by scientists, researchers, technicians. It's put on the instrument, the sample's put on the instrument, the cell sample. And then after that you have analysis, which is again very manual. They manually gate the different cell populations to know the frequencies of them. The issue is that when you are trying to do QC of cell therapy, and flow cytometry is the golden standard, it is very error prone. And you want to streamline as many samples as you can possibly do, because there are patients waiting on the other side to get this cell therapy, which is probably their last resort to survive. Now, sample preparation usually is done very manually. What we've done is we've automated it. So all sample preparation happens in this Accellix cartridge. It's pretty amazing. So this is a single-use microfluidic cartridge. All that's needed to do is to mix the cell sample with the reagents that we provide. These reagents are dried with our proprietary matrix. They're not lyophilized, and they're unitized. So it doesn't matter if we're creating 50 kits or 5,000, you're always going to get the same amount of payload each and every time. So you mix your cell sample, about 2 minutes with the reagents just to resuspend them. Oh, and they're in room temperature, so you're not dependent on a cold chain. You put them in the sample port, right? You put the cartridge in the instrument. The barcode basically kicks off the entire protocol. All of the buffer's solutions are within the cartridge. There are no tubes, no sheath fluid in the instrument. It's all maintained in the cartridge. And this is actually the cuvette. So this is where the sample is read. It's pretty impressive. So the entire sample preparation is done within the cartridge. It's maintained with the cartridge. Once it's put into the instrument, the protocol kicks in, and basically you walk away and you get results in 30 minutes.
And can you change the protocol with the barcode? So can you have different protocols?
So yes, so we create custom assays. It's one of the beautiful things. If you think about it, throughout the entire cell therapy workflow, there are many different checkpoints, right? So when a sample of blood is taken from a patient, right, you want to do incoming screening. So you want to see, what do you have in there? We address that with one of our kits. Then after that, you want to take a look at cell selection, activation, you want to look at purity. We can address that with other kits. After that, usually the company wants to transduce the cell. They want to modify the cell, because that's the secret sauce that makes their cell therapy. So that's where our custom assays come in, and we can create any panel within 6 colors that the customer wants on order, and we create that usually for their release assays.
Fantastic. Now, I know you're speaking this week, so what are you speaking on and when?
So I'm speaking tomorrow, Wednesday, at 12:40 p.m. In the QC manufacturing track. And we're going to introduce the platform. We're teaming up with bioMérieux. bioMérieux is an investor and also a commercial partner. So they'll be speaking on their products, which address other QC checkpoints, such as environmental testing, and we will address the cell phenotyping checkpoint. I'll give them an overview of the platform, share some really cool data that we have from some of our customers that are willing to share, and hopefully we'll be able to help other companies automate their QC to get these cell therapies out faster, more reproducible, launch to other sites, and drive down the cost of cell therapy.
That's fantastic. Now, one question I'm going to ask you is that looking ahead, what do you see the future for that type of technology?
That's a great question. So more cell therapies are going to come out. We're going to need to invest in automation. There's going to need to be a sync between different platforms, right? Right now it's not a one-size-fits-all, but companies are investing a lot in automation, and that's what we're going to see continuously. Because if you take a look at hematological cancers, the CAR Ts that have been approved, they want to reach 10,000 patients a year. If you break that down to how many patients you want to treat per day, that's about 40. With the current methods, with the current workflow, there's no way that companies can meet this criteria. So we're going to need to invest, we're going to need to automate, we're going to need to innovate in this field to get these cell therapies out in a shorter time frame and drive down the cost to treat more patients.
Brilliant. Well, thank you for sharing that. Now, if you want to know more about what you're doing here, obviously come to see you at the booth.
Absolutely.
So the booth number,
we are in booth 24. Remember that, 24.
Fantastic. And for those people who aren't here though, how can you get more information?
So please go to our website, Accellix.com. You can go in there, you can write us an email. If you want to reach out to us via the website, there's a place where you can contact us. You can also read up about our tech notes. We have some amazing reproducibility data that I would love to share. I mean, the first thing that customers want to know is, how do you compare to traditional methods? So we show them how we compare to traditional methods. R-squared values of above 90% and often above 98%. If you want to see the reproducibility, so once you take out all of the manual steps of sample preparation and analysis, you're getting reproducibility that's off the charts. CVs as low, less than 5%. And then why are we doing this? We want to drive down the cost of cell therapy. So if you implement Accellix, you're going to save anywhere between 3 to 4x of the cost just by implementing Accellix.
Well, there you go, now. I know you won't be able to read those that quickly on the screen, but we are going to put the links on the post, and you can click onto those pages as well. Well, Ray, thank you very much for taking time out to talk to me. We'll put the links to the website and to those pages you just shared so you can find out. If you are here though at Advanced Therapies Congress, please come and check out the booth. Booth number once again is 24. He says leading back to see the stand number. But if you can't do that, then obviously check out the website. Leave comments below the video for Ray, and also contact Ray on LinkedIn as well. So Ray, thank you very much once again. Have a great show this week.
Thank you.
Back to the States. Viewers, I hope you found that interesting. Until next time.
Thank you so much.
Stay safe. Bye-bye.
Bye. Thank you so much.